today's topic would be Prathama Rajo Darshan, Menarche, puberty and pubertal changes. In this, we will be seeing Arthava Pravrutti Kala and Nivrutti Kala. Where the Arthava going to जो हमारे संहिताज में एक्सप्लेन किया है तद वर्षात् द्वादशात् ऊर्ध्वम् इति तद रजः सद्ने शोणितम् द्वादश वर्षात् अनन्तरं प्रवृत्तम् इति संबंध पंचाशत क्षेम इति. सो व्हाट आचार्य सुश्रुत ढलन टीका में दिया है द्वादश वर्षात् ऊर्ध्वम् इति यानी आफ्टर द एज ऑफ 12 years देयर इज विजिबिलिटी ऑफ द आर्थव एंड निवृत्ति कालमः याति पंचाशत दैट इज क्षयमिति कब होता है 50 years. So all the acharyas except Acharya Kashyapa has mentioned Arthava Darshan to be 12 years of age and Arthava Nivrutti Kala being 50 years of age. According to Kashyapa फिर क्या है 16 years of age. And 16 years of age was then seen because Kumara as such what Acharya Kashyapa has, yes, so that was the kala when they saw that a girl was getting her first menses. Okay, then as per the modern science menarche is 12 years of age and menopause is around 50 years. Okay, existence of arthava right from birth hai kya, whether it is existing in our body since birth. In Acharya Sushruta in Sutra Sthana in 14th chapter and in Charaka Sharira Sthana 4th chapter, there is an explanation in regarding to the presence of Arthava since the fetal stage but in avyakta form. तो फिर वो व्यक्त कैसे होगा? Arthava takes its व्यक्त form as vaya parinamat. As the vaya gets when proper age is attained, then she will get the Arthava Darshana. स एव गंध विवृत पत्रकेसर कुसुमे कालांतरेण उपचित अभिव्यक्तं गच्छति एवं बालानाम् अपि इत्थं बालानाम् अपि वयः परिणामात् शुक्र प्रादुर्भवो व्यक्तिभावो भवति. सो जिस तरह वो फूल कुसुम का जो स्मेल आएगा कब आएगा उपचित कालम ऑफ कालांतरेण उपचित काल दैट प्रॉपर टाइम पे जब वो फूल बनेगा तभी उसमें से फ्रैग्रेंस आएगा. तो उसी तरह what he is telling is balanam api vaya parinamat, when she attains a proper age then shukra pradurbhava vyakti bhava bhavati. So vyakti bhava any vyaktitva of that arthava is seen. It becomes upachita slowly and steadily when she is attaining her menarche. The darshana arthava darshana what will happen will be slowly and steadily. Simultaneously it also helps in maturation and growth of stana, garbhashaya and yoni. Okay, along with arthava darshana proper maturity of the organs is also taking place simultaneously. ठीक है. देन रोमराज्यादश्च विशेष भाव वय परिणामात् नारीणाम् अपि प्रादुर्भवन्ति आदिशब्दात् स्तन्य आर्तवादयः. ये कहाँ पे बताया है? आचार्य ने लिखा है सूत्र 14th चैप्टर में डलन ने along with the artha darshana विशेषतः रोम राज्यश्च उसके साथ the secondary sexual characters are also getting maturation. Okay, then arthava utpatti described as a part of dhatu utpatti kriya. और आचार्य चरक सुश्रुता अष्टांग संग्रह अष्टांग हृदय और भाव प्रकाश में वो उपधातु ऑफ रस है ऐसे बताया है. आचार्य शारंगधर ने उपधातु ऑफ रक्त है ऐसे मेंशन किया है. तो अगर कोई सीटी लिख रहा है commonly they will ask arthava as an upadhatu of rakta is mentioned by which acharya, that is आचार्य शारंगधर. ठीक है, बाकी के सभी लोगों ने इसको उपधातु ऑफ रस मेंशन किया है. यहाँ पे the ahara which is being ingested gets processed by the jatra agni and the ahara divides into two parts, that is the rasa dhatu and the kittamsha. Kittamsha is malamutra of the ahara what we are taking and rasa dhatuvagni getting pachana forms the prasadamsha and kittamsha. So the kittamsha of the rasa dhatu बेसिकली द रस धातु का मेन कीटांश है स्कफा एंड प्रसादांश में सूक्ष्म और स्थूल रूप में डिवाइड होता है. सूक्ष्म रूप इज रक्त, दैट इज द पोषक भाग फॉर द नेक्स्ट धातु, रक्त धातु. एंड स्थूल अंश में रस धातु पोषक भाग आएगा, उसको स्व धातु पोषण बोलते हैं. और नेक्स्ट इज द आर्थव एंड स्तन्य उपधातु गेट इज प्रोसेस्ड बाय आर्थवाग्नि प्रोड्यूसेस आर्थव उत्पत्ति. नाउ दिस अंडरस्टैंडिंग ऑफ आर्थव उत्पत्ति, व्हेन वी see the utpatti from ahara, why importance of ahara or the diet is the base for PCOD treatment, why PCOD gets treated if you correct the lifestyle, why PCOD will be treated with conditions of thyroid associated. Agar hum when today's day we see so many thyroid patients coming to our OPD. ठीक है, starting में there will be normal cycles. As the days like pass on, when we are into the practice, when we see this patient who is regularly coming, or in between if they miss out, if their thyroid is not in control, then they'll end up in PCO most of the cases. Then what will happen there? If at all we just concentrate on the Agni part of rasa, that is rasa pachakartha or rasa pachaka tablets or rasa pachaka aushadhis, if we give along with that pitta tattva का जो भाग है, there are two types again. पाचकाग्नि का एक है, पित्त तत्व है, पित्त कर्म है. तो पित्त तत्व का जो एनहांसिंग ड्रग्स है, लाइक चित्रक है बेसिकली, तो ऐसे एक नॉन ड्रग विथ रस प्रीणनम, धातु को प्रीणन देना है और उसका अग्नि को बढ़ाना है. This kind of treatment if we give, PCOD will be automatically getting rectified. This you have to understand how it is forming and which agni with what dhatu poshana has to be done is very important to kept in mind when we are treating for mainly PCO cases. ठीक है, next. During the time of formation of that is the formation is avirbhava of arthava, it is saumya due to the influence of rasa, while at the time of tirobhava, that is when it is expelling out, it assumes agneya character due to parinama visheshat. This is important. That is where we tell that the agni tattva or the pitta tattva जो है उसके ऊपर अगर हम concentrate करेंगे तो she will get her menses, but we have to also nourish the rasa part, that is the rasa dhatu has to be rectified and it has to be done the preenan, उसका कर्म जो है वो हमको करना है. Along with that we have to also see the tattva, agneya tattva of the pitta is enhanced so that we get menses. Okay, for that one example is given by Chakrapani Tika. Yatha tejasa parthivo dhuma bhavati, जब हम अग्नि डालते हैं तो उससे जैसे धूम आता है, we have to give that. Now this was explanation regarding the arthava, how at what age we see, then how it is उत्पत्ति उसका कैसे होता है, and रस तत्व का importance क्या है, धातु का importance क्या है, और आग्नेय तत्व in the रस धातु how it is important in helping out for the menarche to get started. Now puberty. It links the childhood to adulthood, from the Kumara Avastha to a girl, adolescent girl. This period gradually development of the secondary sexual characters is associated. Modern people are also explaining same as we have in our classics. Then Tanner and Marshall's 5 important physical changes are evident during puberty. These are breast, pubic and axillary hair growth, growth in the height and menstruation. So these 5 important physical changes are evident and they are the main examination part if the woman or sorry the girl has not attend her menarche. Primary amenorrhea अगर patient आएगा हमारे पास तो these factors are to be examined for. What are those? Breast, secondary sexual characters, whether they are properly developed or not, pubic hair and axillary hair growth हुआ है या नहीं. As the age advances, the mons veneris will properly grow in size. Along with that, there is a secondary sexual character is the growth of the hair on the mons veneris and also axillary hair. So we have to check for these two. Then growth in height. height properly hua hai ya nahi, or whether sometimes short stature girls will be there, like her mother is also of short height, then we shouldn't tell, and your height has not grown, then you're having problem. No, if the familial history everybody is short, then we have to like say it is normal. Only if everyone in their family is tall and our height is very short, less than 4, you can consider 4 feet, then we have to tell there is retarded growth retardation is seen. And it will be commonly associated with pituitary problems. Then menstruation. Okay. The most common order in is beginning of the growth spurt, that is breast budding, thalarche, adrenarche, and menarche. These are the three important way of like first it will be a thalarche, that is first the development of the breast will start. If you observe for an adolescent girl who is into the pubertal stage, where she may be still under nearing to get her menses, say 1 year or 1.5 year, nearing to turn to an adolescent, we can properly see the changes. That is, first there is a thalarche change, that is the breast is properly growing, or the development of the breast tissue is seen. Then pubic and axillary hair, that is adrenarche, where the development of the hair on the pubis and axillary, and peak growth in height. You might be heard like in the family they will tell girls will grow until they get some 16 17 years of their age, they'll grow so early. Boys will grow after 21 to 22 years. That is how the physiology is there. Before and all, they used to tell girls are so mature enough than the boys. Whenever we used to hear this, the boys would get so agitated, but that is the fact. Boys will get matured, or they'll get the stability by the age of 23 24. Girls will get the stability by the age of 17 or 18. Okay. And even that was the reason for fixing the age of marriage also. Then menstruation, that is the third part or last part of the development. Then changes are usually completed between the age of 10 and 16 years, because that was the time when we have seen that the girl will get her menarche from 10 to 16. Nowadays at least we are seeing girls of even third standard, fourth standard, like 9 10 years. Sometimes even few girls parents will come, they'll tell a few of the students in our school, like their friends have already attended their menses in second standard holidays, 8 9 years in between. That time also they are getting. That is also precocious puberty. What is one of the reason? But technologically, girls are so much exposed to the phone, the TV, the media in and around. Then the food what they are eating is so much estrogen dependent. The gobi manchuri to pucho hi mat. These girls, like girls until I think almost many of them are like, what is your favorite food? They'll be like gobi manchuri is our favorite food. No, or junk. Someone will tell we like burger, pizza. These all are the one which will increase the estrogen metabolism, and they are more towards getting early menarche. So this is one of the factor. That is also one reason where we advise the girls or the parents of the girls to not expose them more with the at least junk food, rather give them home food. Abhi technology ko to we cannot tell na ki put them in the room, don't put TV, don't see phone. This is all we cannot do that. So at least we can educate them that give restrict the time. Don't see, at least parents should not see uh, the songs or the videos which will trigger the mental stability of the girls, at least when the kids are around. I think if everyone remembers in the previous era, parents would not allow kids to watch. Now it is like parents will take them to theaters, everything like whatever uh, they are going along, they'll take the kids with them to the movies and all. In the movies, there we cannot stop the kids, don't see and all. So you have to educate the parents, or at least ask them not to give outside food more. Ask them to prepare home food and give, especially for girls. Yeah, boys for also, yeah, I don't say, but at least for attaining a proper menarche at a proper age, it is always advisable to at least give home food 10 years of her age. Until the 10 years of her age, please educate ಎಷ್ಟಾಗ್ತದೆ, I mean, it's a very important thing that you educate the society, at least do a social service. Then important controlling factors for onset of puberty are genetic. Yeah, see, genetic is common. If we will tell, when did your mother attend or your sister has attained her first menarche? Sometimes they'll come. She has attained her menarche at 10 years. Andre have in previous era. Now they'll tell 9 years or something. They'll come to us. Then we will ask, at what age did you get? Basically a sister. Mother to, if she tells I've got it at 11 years and all, then it is okay. In that era 11 years is early only. So then her sister, if she's there, or only one kid is there, then commonly one kid will be there nowadays. So what age her mother has attained her menses, 2 to 3 years prior to that is also okay. 2 years, not 3 years, 2 years prior to that is also okay, because of the exposure what the kid is having. Then nutrition, yes, overnutrition, excess amount of estrogen being supplied, she'll get early. Or kshaya, rasatah kshaya, emaciated girls are there, vata pradhanatah, then they'll get a little late. Then body weight, obese hai, that is also important to keep in mind. Sometimes what will happen, the excess BMI girls who will get menarche on time, one shot, 1 year, 2 year, there is no menses, they'll end up into PCOD. Psychological state, how much they have been exposed with the technological things or the abusing videos, or whether they have been abused when they are child sexually, they have been abused, assaulted. There are so many cases, no? So that is also one of the factor. Or how is that girl being grown, in which kind of environment she is growing, what kind of people are around her, what kind of things she is getting to see. Sometimes we see that the girls of small school going girls of two, like second standard and all, they get exposed, they'll see the seniors of the schools girl, like friends and all, they are like kissing each other, they are like roaming around, they feel, okay. So see, this kind of atmosphere is available in the school also. It is not like they are not getting exposed. If even if we have not allowed them to see TV, or we have not given them junk, the environment or the culture which is there in and around, they are getting exposed. So as much as possible, we have to give them good samskaras to keep them grounded, to keep their brain grounded. Sanskrit chanting, chanting of shlokas, chanting of Devi mantras. These are all having good effect on maintaining the psychological status or the grounded thoughts of the kids, even for boys and girls. Then social and cultural background. Basically, if they have come from high class culture, like if you see, or very low class, where in house the husband is drinking and coming and is sexually assaulting his mother, her mother, or in a high class society where you see people are getting exposed, these all count. And exposure to light and others, UV rays. Basically, if exposure of too much of hot temperature is one factor, and too much of cold temperature, if they go into the ice like Himachal, or if they go into Kashmir side where there is very cold weather, they'll get late menses. If they're exposed to very hot weather, they'll get early menses. Then endocrinology in puberty. Due to negative feedback effect of estrogen to hypothalamic pituitary system, that is gonadostat, levels of gonadal steroids and gonadotropins are low until the age of 6 to 8 years. Okay, starting immediately after birth, 10 to 13 days or 13 to 14 days of their birth, estrogen of which is from the maternal side, the is there in the baby, girl baby. That's why she will be having mild discharge. Okay, then it will stop by 13 to 14 days. Then what will happen, there will be gonadostat, and she will have the low levels of gonadal steroids and gonadotropins. Thereby the antral follicles which will be growing post the menarche will be in static position. They will not be there is no division or growth in the cells. Then hypothalamus, what will happen? The hypothalamus, the GnRH pulses from the hypothalamus results in the pulsatile gonadotrophin secretion first during the age advances. Okay, as the age advances, the GnRH secretion is there. Thereby, FSH and LH are secreting, and it triggers the estradiol for the growth. Then thyroid gland plays an active role in the hypothalamo-pituitary ovarian axis. So, one of the factor for PCO to also have understanding with the thyroid function is very important. अगर आपके पास PCO का पेशेंट आएगा तो आपको उसका थायराइड प्रोफाइल भी चेक करना है. Sometimes what will happen, even thyroid is normal, फिर भी there are symptoms of thyroid metabolism, like this, like they are not properly, metabolism is not taking place because of undiagnosed condition, that is called क्या बोलते हैं, false positive. It's not properly बायोकेमिकल मार्कर्स जो है ना वो प्रॉपरली नहीं दिखाता है, लेकिन सिम्टम्स विल बी देयर. सो वी हैव टू लुक आफ्टर द सिम्टम्स बिकॉज इट मे नॉट बी प्रॉपरली एस्टैब्लिश्ड. अभी तक उसका बायोकेमिकल इसमें उसका वैल्यू चेंज नहीं हुआ होगा, लेकिन सिम्टम्स विल बी देयर. अर्ली डायग्नोसिस विथ ओनली सिम्टम्स और क्लिनिकल एग्जामिनेशन पे आपको लुक आफ्टर करना है. एड्रेन थायराइड का सिक्रेशन या थायराइड फंक्शनिंग इज सो इम्पोर्टेंट. वन मोर फैक्टर आपको याद रखना है कि पीसीओ के कंडीशंस में आपको पेशेंट को क्या बोलते हैं, सुबह का, इज इट लाइक आई टेल इन इंग्लिश, अर्ली मॉर्निंग when the sunrise is there, ask the girl to sit in that sunlight for at least 5 to 10 minutes because of so many hormones getting channelized, and also for the thyroid to function properly. It is advised in PCO cases to advise, even in thyroid cases also, advise the girls or even boys who are having, like there is commonly a problem with the thyroid, you can advise them to sit in the early sunlight. सुबह का जो किरण आता है, you ask them to sit in that sunlight for at least 10 to 15 minutes and do the प्राणायाम. अनुलोम विलोम करने से बहुत अच्छा रिजल्ट आएगा. Okay, you can do that. Then adrenal glands is the adrenarche. Second, where we see for after breast development, there is increase in the activity of sex steroid synthesis, that is adrenostenedione, DHA or DHAS, about 7 years of the age. Increased sebum formation, pubic and axillary hair, and change in voice are primarily due to adrenal androgen production. And also, if it is more, then she will end up in PCO. Then gonadarche is increased amplitude and frequency of GnRH. There is increased secretion of FSH and LH, ovarian follicular development, thereby secretion of estrogen. This estrogen is responsible for the development of uterus, vagina, vulva, and also the breast. Then menarche. The onset of first menstruation in life is called menarche. It occurs between 10 and 16 years, peak between 13 years. It denotes an intact HPO axis, functioning ovaries, presence of responsive endometrium to the endogenous ovarian steroids, and the presence of patent uterovaginal canal. Patent uterovaginal canal is also important factor ना. mechanical कोई congenital anomalies नहीं है, the path is open, it is functioning, that is also very important. During examination you should also look after for the opening of the vaginal orifice is there or not. The first period is usually anovular. Okay. Genital organ changes. The ovaries become elongated in shape. It becomes bulky and oval. The uterine body and the cervix ratio at birth is about 1:2, and the ratio becomes 1:1 when menarche occurs. So the uterine body is the upper part and the cervix, I think everyone knows. It is 1:1 at the time of menarche. Enlargement of the body occurs rapidly and the ratio becomes 2:1 in life. This is the changes which we see from birth till 5 years of age. At birth, it is 1 is to 1. At, sorry, 2 is to 1. At Menarche, it is 1 is to 1. Nulliparous, it becomes upper ka part 2 is to 1, and then slowly it shrinks and it becomes atrophied. Okay. The vaginal changes are more pronounced. A few layers of thin epithelium in child becomes stratified epithelium of many layers. Okay. The cells are rich in glycogen due to estrogen. Doderlin's bacilli appear, which convert glycogen into pH between 4 and 5. So the normal pH is acidic and it is 4.5. 4 and 5 के बीच में का 4.5. The vulva is more reactive to steroid hormones. The mons pubis and the labia minora increase in size. Breast changes under the influence of estrogen. There is marked proliferation of the duct system and deposition of fat. See, first, though the budding of the nipple or the breast will start, the proper growth of the cells or the proliferation is growth of the duct takes place once the estrogen is being produced. Okay, for this, triggering of the ovary has to take place with the production from GnRH, then FSH, LH. Then FSH is the one which will help in the growth of the anther follicles. These have production of estrogen, and they help in the development of all the secondary sexual characters in maturation. Okay, though there is budding, there is starting of the factors, but proper maturation will be under the control of estrogen. Okay, and the breast becomes prominent and round under the influence of progesterone. Once ovulation happens, the development of acne increases considerably. Acini or internal cells of the breast. Common disorders of puberty. इसमें आता है precocious puberty, delayed puberty, precocious puberty early than 8 years, or delayed puberty, even 16 years of her age, she has not attained the puberty. Someone has messaged. हाँ, PDF तो मैं इनको भेजती हूँ ना, यार विजय उनको. They will share. Okay, no issues. Then delayed puberty, even 16 years of age has passed and still she has not attained her menses. It is called delayed puberty. First is, whenever such girl comes to our OPD, first examine for all the secondary sexual characters, check for the patency of the opening, whether the vaginal orifice is open or not. Then send for a normal scan whether any congenital anomalies are there. अगर secondary sexual character सभी बराबर है तो एक scanning भेजना है. फिर scanning, if it comes normal, send for an hormonal assay whether the HPO axis is functioning or no, and then if that is also normal, then you can induce and see. Okay. Then menstrual abnormalities, amenorrhea, menorrhagia, dysmenorrhea are all the different yoni vapas in menstrual abnormalities what we'll be studying. And other like infection, neoplasm, hirsutism, associated infections se bhi hum we can see abnormalities in the menstruation. So this was the class for today. If you all have any doubts, you all can ask me. Or importance of what do you say, menarche in examination would be like, whenever a girl comes to our OPD with any complaints, it may be white discharge, it may be dysmenorrhea, or it may be backache, or whatever complaint she may come, compulsory ask her the menarche age. It is important because we will get to know how her cycle was and from what age she has attained. We can compare the maturation of the secondary characters, and also we can assess how is the HP axis, like वो तो है ही, HP axis of hypothalamus and pituitary being matured, other hormonal functioning of thyroid and adrenaline will also be helpful in understanding. Also, sometimes they say that early menarche, early menopause. This is like almost a theory which has been told, because the क्या बोलते हैं, the ovarial function will reduce because she has attained her early menarche, and the follicles inside will be getting over early is the thought process. But sometimes it is not true, because if she has got many anovulatory cycles, then it is not the fact. That has to be understood. Or other than that, I think everyone knows AMH, anti-Mullerian hormone, which will be a marker for knowing the, what do you say, follicles, like ovarian functioning. अगर follicles है या नहीं check करने के लिए AMH is one of the factor which we have to also take into consideration. And commonly अगर menarche में हम concentrate करना है तो that is HPO axis only ना. तो अगर H and P is normal and if O is not functioning well, then it is commonly okay. If patient not get menarche at the age of 18, then which investigations? Yeah, first, when even if she has not attained at the age of 18, वही तो मैं बोल रही हूँ, पहले check for the secondary sexual characters. Then after secondary sexual characters, if everything appears to be normal, then secondary sexual तो पता है ना, breast देखना है, pubic hair देखना है, axillary hair देखना है, then abdominal alba है क्या देखना है, then you see for vulval part, then check for height, and then also you see for patency of the uh, vaginal introitus, अगर open है या नहीं. Okay, then उसके बाद में you check for USG. पहले USG भेजना है to check if any congenital anomaly is there or no. You can also ask for the patient that when did your mother attain menses, or when your sister attained her menses. That is also important. Then उसके बाद में in which place she is staying, which kind of environment she is staying. If she is staying in a very cold uh, uh, place, then check for ovarian functioning. Sometimes if the optimum temperature is not there, the ovary may not function because it needs a proper temperature, even warm temperature, to function properly, or a shrinkage will be there. So that also has to be checked. अगर सभी normal है, then you go for hormonal, sorry, chromosomal examination